Hi guys, I'm Dr. Mack. I'm a reconstructive urologist. It has taken a long time and a lot of courage to start this endeavor. This will probably be the only long form video I make, but I am 8 years into practice and an associate professor of reconstructive urology, and about 15 months ago I became a stage 4 breast cancer patient. And I laid awake many a night for hours and had a lot of time to think. And I thought about legacy and time and what do you do when you're only given a certain number of years to live. I had envisioned this long, illustrious career where my primary goal would be to train the next generation of surgeons, kind of like a rock thrown into a pond. There would be ripples, and I would train one person and that person would train several, etc., etc. Creating kind of a lineage or dynasty, passing on the things that I painstakingly learned through years of effort, trial, and error. But that is not to be. So let's make some lemonade. Let's make the best of a bad situation. How do I train the next generation of surgeons if I'm not going to be around for years and years and years to do it in an operating room? And the answer is to distill down what I know into short form videos and disseminate it freely to the next generation. My thought process here is that you guys have been hardwired, like your literal neural circuits, from the young age where you were just learning how to read or do math or whatever. My children are currently in elementary school. They're doing all those things. You learned through digital learning. You learned through gamification of education. You learned through sound bites and video clips. And that's been repeated. And what we know from operant conditioning is that, trains your brain to function a certain way. So medical school currently has lectures. We have chapter books, like these long books. My Campbell's Walsh Urology, I don't even know, like 3,000 pages. Every chapter is something like 70 pages. It would take hours to sit down and read that, just like a chapter now, because it's so dense. Whereas, interestingly, I happen to own a hobby farm, and when I started my career as an attending surgeon 8 years ago, I had never done any farming. I had never even gardened, but I bought into a dream. I dreamed big, and I bought my dream house on a dream piece of land, and I started watching YouTube. And I kid you not, I just watched YouTube videos here and there, and then as I started to go up for associate professor, you really have to write a lot of papers to climb the academic ladder. And so, terrible as it sounds, I hired a regular babysitter for Sunday mornings. And for better than a year, every Sunday I got up and had my coffee, got my kids' breakfast started, my babysitter came over. And rather than jump right into paper writing, I would watch YouTube videos on gardening and plants and all sorts of things for about 30 minutes, just different videos. And the amount of information I have picked up from just steadily watching YouTube videos, I would now say I am a semi-expert gardener from a complete and utter novice. Now, some of that is trial and error. You actually have to do. You can't just watch the video. But I am going to arm everyone with how to hold the instruments, how to use the instruments, tips and tricks, analogies I use. I'm going to take the information that was so carefully gained through hard work and practice and distill it into 2-minute sound bites and gift it to everyone. Who I envision this helping? The next generation of surgeons, to be sure. But let's say you're going to go into neurosurgery or dermatology or interventional radiology, one of these really competitive specialties, and you need honors in all your rotations. Going into an operating room prepared will get you a long way. I'll give you the tips and tricks to fare your rotations really well. I'll explain generational shift to you, why the older surgeons think like they do, and why you think like you do, and why those two things, they don't mesh. here I am, a geriatric millennial stuck right in the middle of the older generation of surgeons, the younger generation of students, and I see both sides. They both make sense to me. I see why they want you to prepare and read books, and I see why you don't want to do that. Why would you do that when you could just watch a video on surgery in 2 minutes right before the case? Anyway, all of that is to say, those who can't do, teach. I can't make it through a regular surgical day. The reason this doesn't exist right now, I thought about this too, is because all of the people who are able to be highly technical, successful surgeons are out there doing it. We're being crushed under a never-ending workload. Every time you get, a day of surgery done, more and more patients come. I had a 60 to 90 day book out in clinic just to talk to me. So we need more doctors. We need more surgeons. We need more people to take up the charge interested in healthcare. And the ones out there doing it who are super busy, they don't have the time to make these videos. So in a way, my cancer diagnosis I will view as a gift, because now that I am too disabled to work a full day, I have a little bit of extra time to chat with you all and make some videos and disseminate my information. So with that, I hope you find this useful.